This skill is nasotracheal intubation of an adult. So BSI seems safe, taking standard precautions. I'm going to come up to my patient, first off assessing my patient whether they are responsive or unresponsive. For this skill's sake, this patient will be unresponsive. So I will come up to my patient, sir, or ma'am, can you hear me? Give him a sternal rub. I will feel his carotid pulse while listening for his breathing. In this case, I note that he will need an airway adjunct. So before I place in the airway adjunct, I'm going to inspect the nares, noting that the right nair is going to be used for this NPA. So I'm going to grab my NPA and I'm going to place the NPA at the right nair just after using my KY jelly. So I'm going to lubricate it. Now I'm going to place the NPA bevel towards the septum, inserting gently. Right after that, I'm going to, once it is inserted, I'm going to start BVMing my patient, 1 breath every 5 seconds to 6 seconds, or 10 to 12 breaths a minute, making sure I don't go under or over that ventilation number. So while doing this, I'm going to hook up my oxygen, delivering 100% oxygen, along with hooking up my capnography to my life packs. That way I can measure his capnographic waveform. So I'm going to deliver my patient and pre-oxygenate my patient with 100% oxygen for at least 3 to 5 minutes, just to adequately pre-oxygenate them. So once I've pre-oxygenated my patient, I'm going to assemble all of my equipment. So I have my ET tube with the stylet, along with my 10 milliliters of air in a syringe. I have my KY jelly to lubricate the ET tube. I have my ET tube securing device, along with my stethoscope, and of course I have my BVM connected to the oxygen cylinder. So I'm going to deliver one last breath, still continuing to hold the EC clamp method. So I'm going to deliver that breath. I'm going to remove the NPA. Okay. So I'm going to grab this nasal. It's going to cause nasal mucosa to vasoconstrict, allowing more ease for the ET tube. So I'm going to tear this open. I'm going to lubricate my ET tube. Now I'm going to insert the ET tube bevel towards the septum. I'm going to completely make a circle with my ET tube so that way it's easier to go through the nares. So bevel towards the septum. I'm going to insert it whenever they take a breath. So if my patient was awake and alert at this point, I would ask them to breathe in and I would insert it with each breath. So we'll say breath, I'm going to insert. Breath, I will continue. Breath, keep pushing. Breath. Okay. So before I go any further, I'm going to place it just superior to the vocal cords. I'm going to look inside within the mouth, looking for any condensation within the ET tube, noting that that is just above the trachea. So I can also hear that there is breathing coming from the ET tube, so I note that I'm just above the vocal cords and above the trachea. So whenever they breathe one more time, I'm going to insert it further. So I'm going to insert the ET tube. Okay, I'm going to inflate my ET tube and disconnect the syringe right off the bat. So once I have that secured, I'm going to connect this. Okay, continue to connect. I'm going to deliver breath. All right, so I've secured the ET tube with my hand, noting the depth, and it's just at 21 centimeters. Okay, so now I am going to continue to oxygenate my patient with the capnography hooked up. still delivering one breath every 5 to 6 seconds. I can monitor the patient's breathing, whether they are perfusing adequately and I'm delivering my ventilations appropriately with my capnography. I will then, if I have a partner, I will then ask them to bag my patient. So with them still holding the ET2, because we don't want to secure it before we auscultate the epigastric. So breath, breath. I'm going to do 2 more. Breath, breath. Okay. So I note that there is no epigastric sounds, so therefore, in fact, I can see adequate chest rise and fall, and I know that I am within the trachea, so I know that I'm perfusing the lungs correctly. So now I'm going to come over here, deliver a breath, still continuing one breath every 5 to 6 seconds. I'm going to actually secure this ET tube with tape. So I will have my partner or either myself, I will tape the ET tube to his nares, making sure that the ET tube will not dislodge from his vocal cords, either going further into the lung past the trachea, or being removed from the nair in all. So I'll continue to oxygenate my patient.